Okay, it looks like we have some people on, if I'm correct, right? So anyway, I think we have a few more people registered. We're still keeping it kind of light and tight to the Be Her members. So right now, I was going to have a guest with me, and I think it'd be really fun in the future if anybody wants to volunteer to be a guest so that we can kind of have a discussion with a couple people on the webinar that want to talk about it, and we can obviously decide the topic in advance. And then everybody else that's present can also ask questions and, of course, pipe in and stuff. I just don't want it to turn into like me talking about things I love, although that is a blast and I always enjoy that. Tonight, I wanted to talk about biostimulators because biostimulators are becoming like such a huge thing. Everybody, back in the day, injectables were taboo. We'd only hear about them at our plastic surgeon's office. And really the best way for anti-aging was plastic surgery. That's what people did. People got surgery. They want this tighter. They want this line gone, blah, blah, blah. And we've learned there's so much more we can do without plastic surgery, and not everybody's a candidate for surgery either, right? Because this has high risks. A lot of people shouldn't be under the knife that long, anesthesia, anybody with heart, lung, high blood pressure, issues like that. It's never as safe to do anesthesia. So now we're starting to talk about what can we do to prevent surgery. I am a med spa owner, but my main specialty was always injectables. So, I'm going to love talking about the injectables that we can talk about, which are biostimulators. But there's also so much else we do. And I don't mean just us as injectors. I mean us as med spa owners and any anti-aging expert or provider. So I talked a little bit about the plastic surgery, and that's where the injectables started coming in. But really, it goes all the way back. So if we think of plastic surgery as kind of like, ooh, that's like the highest, the last highest step, I guess, plastic surgery. You go down, injectables, some energy-based devices, some stuff that you can do at home, and then things that are non-invasive completely, like skincare, which are also things we do at home. Now, even if you can't offer all of these services, and I like this, I'm looking at the poll. A lot of people are knowing about the injectables, which we'll definitely talk about. I'm writing notes because sometimes when I babble on, like I forget something, I'm like, what was I going to say? So I'm writing things that I don't want to forget. So injectables, of course, microneedling is awesome. We talk about retail skincare and laser therapy too. I do want to start with retail skincare because a lot of times people are coming to us, and hopefully if we're an injector or a med spa, our turnaround is approximately every 90 days because that's the shortest acting thing that we deliver. So our toxins, they're usually about every 60 to 120 days, depending on if people like to stay frozen, like to get full movement before they re-inject, or if they're just people that inject for a special occasion or something. But there's a lot, if they're coming in once a quarter, let's say just to get toxin, which is not a biostimulatory, but it's an anti-ager. If they're coming in to get toxin every 90 days, we also want them doing stuff at home. So every 90 days, they could be spending $500, well, let's say $300 if they're just doing a little area, up to $1,000 or something. Like me, I do approximately 85 units for my whole face because I do things like chin, depressor anguli. I do a little bit of lip flip. I do under eyes. I do crow's feet. I do glabella. I do forehead. I do a little bit bunny line everywhere. So it comes out to usually 85 units. So if these people are spending like $1,000 or something when they come see you, what about the things they can do at home that are actually going to kind of feed that $1,000? It's like, if you get your grass cut every year, but you're not getting fertilizer or anything like that, eventually your grass isn't going to do that well. So you're paying somebody to mow the lawn, but you're not fertilizing the lawn. We want people fertilizing their faces too. So I think skincare is crucial. Now, whether or not you should retail all the skincare you want to retail, that's up to you. The things to consider when opening accounts is like, how much do you have to spend per quarter? Can you buy just one product, or do they have a minimum? Like I need 6. Do you have to buy their whole line, or can you just buy what you're interested in? So skincare, I do think it's nice to offer a little bit. If you're not going to offer an entire brand or an entire line, one of the great things to do is find a private labeling company that has some good skincare. And these are the things that people really look for. Like what can they do for their neck, for their eyes? They always want a cleanser. They want an exfoliator, and then they want an anti-ager, right? The anti-agers that we sell at home, the absolute best ones we can get are going to be your medical grade anti-agers. So that's your growth factors and your tretinoins, retinols, retin-A's, things like that. And I'm going to do a quick screen share because I just learned how to do that a few minutes ago. Does anybody want to interrupt or say anything? Actually, let me make sure I'm always watching the chat box too. So I'm going to share real quick the skin itself, because this is kind of important. If people don't understand exactly what they're talking about, your clients may not figure what we mean. You know, we throw these terms out. I do think it's important to talk about the terms, because that, number one, shows that we know what we're talking about. But number two, I think it also gives your client a little bit of confidence in what you're saying. So when I look at the skin right here, I like this diagram, and there's millions of these out there. If you look at the top, like this fatty or little bubbly kind of purple layer, that's your epidermis. So that's the real superficial skin layer. That's what you want looking nice, so that your skin looks nice. So that's where we put our HAs, our moisturizers, things like that, or, you know, makeup primers or whatever, so that when you put on makeup or sunscreen or whatever, your skin looks smooth and your pores look small, etc. Then this is like your real beefy layer. The next one is the dermis. Inside that dermis, if you look at these little flat shaped cells, those cells are the fibroblasts. And fibroblasts are crucial. What they do is those fibroblasts are what get signaled to release elastin and collagen. Elastin and collagen are what keep your skin kind of being repaired, looking good, looking healthy. If you have an injury to the skin, collagen type 3 is going to go over there and do wound repair. If you know you've got your collagen that's actually there to help stimulate the skin itself and hold the skin together, that's those elastic bands. And then also the elastin itself is what gives you that nice tension and kind of the bounce back. So as you get older, you do want your skin to stay tight, but you also want it to look plump and hydrated. So a lot of these things that we're talking about, it's important to know the depth of the skin, because that's what you want to be able to target, right? Does that make sense? And then we get into the hypodermis. This is like a little bit deeper, and this is where that danger zone, like your SMAS, is. When we talk about avoiding the vessels, those are your big red and blue veins and arteries. So I always like to go back to the basics and make you guys suffer through that part with me. So that's the skin that I kind of wanted to show you. So when we talk about people using skincare at home, we want things with growth factors and the tretinoins. Those are the things that stimulate the fibroblasts. So I do think it's important that if we're going to be taking, you know, $3,000 to thousands of dollars every quarter of somebody's money, wouldn't it be nice to be able to explain to them why a skincare at home that you can put on twice a day? It's like brushing your teeth. You know, you don't just get your teeth cleaned at the dentist. You kind of try to do it yourself too. And we may or may not tell the truth about how often we floss and brush or whatever, but we should be doing it a couple times a day, right? That's what they say. You should be doing the same thing with your eye creams. A lot of time, or in all your anti-agers, people will come up and say, well, what do you do for your eyes? I'm like, well, I do all of it. You know, I do the microneedling, I do lasers, I do eye creams, I do growth factors, I do injectables, I do fillers. So it's not just a, you know, one-stop shop, but it's like I go back to the grass thing. If you get people to fertilize their grass, they will have better grass. You can't just cut it. You have to treat it well. So that's the stuff that we can retail. So I do think it's important to at least explain about why you want to carry skincare. And if you're not going to retail it or private label something, it's good to have a place to send them. And I know a lot of it's available online, but when you send people away, remember, they might leave for good. So you want to make sure you don't send them to a competitor that has a brick and mortar that does what you do, you know, but you might, if you have a skincare line that you like, a lot of people don't want to carry retail. And so they'll get an account with something like Skin Better Science or NeoCutis, and they actually have an online portal where patients can order and use your name and get products sent to them. And by using your name, you still get a little bit of credit. So that's something to consider if you're not really sure you want to start dusting off your shelves and buying enough product to sell in a retail space, or if you're somebody who doesn't have a huge retail space or something like that. The next level up, I would say, would be, you know, if I'm starting at the bottom, like the bottom being what we do at home and the top being like under the knife, the next level up would be those home care treatments. And so there's a lot of things people do at home that aren't just skincare, but they're actually devices. So these might be things where people do derma rollers, if you've heard of that. They'll kind of roll their face, or they buy micro needles that they can actually do on their face at home. These don't necessarily have to be medically cleared. They do definitely stimulate collagen. And if we go back to that skin diagram, you remember I showed you, we just want to be able to hit that fibroblast, stimulate that fibroblast. If we go back to that, these microneedlings and things like that, what they're doing is they're going to use a mechanical injury, so like an actual poke with the needle, and using that energy or that poke and the mechanical stimulation, and it could be with energy, so things like radio frequency microneedling, or it could be with product, so people microneedling in an actual like growth factor or something like that, or microneedling in PRP. They're not going to do that at home. Obviously, you're going to do that for them. But you can microneedle in stuff. So now you've got two mechanisms of stimulating collagen. You're using the needle itself to kind of cause that wound, but also you can get in a product that way. And things like I said, like PRP, but also you can buy off-the-shelf sterile products that are meant to be microneedled in. If you look at the MedShift store, we do PDO Glow, which I love. PDO Glow is cool. It's a bunch of PDO sutures kind of chopped up into tiny, tiny pieces, and you stamp them into the top of the skin. I do like to caution people, there is evidence that the depth that you microneedle is important. And so if you go back to like the expert, I think his name was Curtis Settenfield. I think he wrote the book on microneedling. But anyway, he did a study and it said the actual average depth to hit that fibroblast and to get your microneedling is 0.6 millimeters. So when we have skin pens or Morpheus or whatever, we want to remember that, you know, a quarter millimeter is not really going to be enough to stimulate collagen. So even when you're going on those delicate areas like under the eye or the crow's foot or even the forehead, you know, not that it's as delicate, it's just so bony that it can be sensitive. I try to make sure I set my needle at least 0.6. And if I'm having them or if they're asking me for advice on a microderm roller or something to use at home, I recommend try to get something at least 0.6 millimeters. Now, when we're going deeper for things like acne scars or something like that, you do want to get deeper because you're trying to break up those fibrous bands that cause that scar. So I tell people when microneedling, if you're going to do one device at home, get it to be at least 0.6. I know some brands will sell 0.75, which I think is great. It's not, you're not going to get terrible bleeding like the pinpoint bleeding that could cause a lot of downtime, but you might get enough stimulation. You're pretty pink and red, but you're also getting results, you know, because you're getting to at least the 0.6. Other stuff people do at home, there's a lot of evidence. I don't know if you follow like fasting and Prolong, Valter Longos. There's so much evidence that fasting helps increase your own growth factor. So that's the IGF, but also reduces inflammation and stuff like that. So anytime we're increasing our own growth factors, we're doing something good. A lot of people now have red light therapy. I'm a huge fan actually of the red light therapy. Number one, because the risk is so low and the reward is so high. So if you have a nice red light, a lot of people will use it in their spa. They might offer red light therapy after injections in case they got a bruise. It definitely helps speed up bruising. They might offer it after a facial, like after salt facial has a little bit of a light on it, or maybe they use like a Saluma or the, my favorite is the one on the MedShift store. I actually just got it, I think this spring, but I love it. That's really nice because it gives you a nice charged joules of heat. They also make small handheld ones that you can do, you know, an area at a time. I do like the big device because you can kind of do your whole face, neck, and chest at once. And they do recommend a couple times a week for the first 12 treatments or about 3 months. And that's when you'll start seeing results. So those are other things people can do at home. Now we start talking about like what can we get once we get in the spa? So this is where I get really excited because obviously I like inside the spa stuff. This is where we start talking about our injectables and our devices, our bigger devices, not our take-home devices. Like I said, the little rollers or the doctor pens or whatever needles that you have. I did just get a question. Do I suggest that at home or like to, you know what I do? Do I suggest it? The question is, do I suggest it to my patients? Or do I encourage it like if they start asking or whatever? I do think it's important to keep in the spa. I love recommending it because like I said, it's like brushing your teeth. The more you do at home, the better the stuff you're paying me for to do. So a lot of times people will retail some of these devices and you can, you know your clients best. So if you do have a really good following, people that, you know, want to do everything, sell a few of these red lights so that they can take home, or sell some of these devices for them to take home. Even if you can't sell it, I do feel like it's so important to at least know it's there, because if you don't offer it, but somebody asks you about it, you want to be able to say why you don't offer it and whether or not you think it's good. And I mean that candidly and honestly. You know, I might say, I absolutely love red lights. I like really good ones. And the best one I think that you can get for at-home use is a couple $1,000s. So I may not sell it, but I can definitely order for you, you know, something like that. Or I might say something like, Yes, I think the little bits that you can do at home are going to be good, but you still need to supplement it with a little bit higher medical grade treatment that we do at home. I try to be honest. I don't, well, I am honest. I don't try, but, also we have to keep in mind what can people afford. So a lot of times I say, what is your budget? If this was your budget, where would I start you? Knowing that you may, if these kind of treatments and therapies that you're doing are bringing you a lot of really good feedback and you're really enjoying it, you're probably going to increase that budget, that quarterly or yearly budget, to add in like little things like devices to use at home or more skincare or whatever. So I have to say, I think you should have it in the spa, but I also think you should encourage home use, and this is another way to increase your own retail options. And even if it's something big, I tell people, I used to sell the hair helmets. I would do a lot of PRP for hair and sell the helmets. Helmets were expensive. Not everybody bought them, but a lot of people did. And if they wanted it, I'd say, okay, because I had to buy 3 at a time. And I'd buy my 3 and then I'd, sell that one and I'd have a couple in the spa. Or I would send them to, a site that I know is reputable enough to buy it. That is one of the things I like about the MedShift store, though. You can get a lot of these products and retail them on your shelves too. So even if you didn't want to carry them, you know where you can get it. So you could buy it later, for example. So that is a good question. Thank you. Okay, so then let's go to the spa-like stuff. Devices. So there are devices that are definitely going to increase collagen. And again, these are going to be more expensive treatments, and they're going to be something that you do maybe 1 or 2 or 3 times a year, maybe every other year. And there's a lot of choices. I think some of my favorite, if I go to the devices, I love lasers, and I have hyperpigmentation and I have acne scars. So lasers have been amazing, but also I'm fighting fine lines and wrinkles like everybody else, I think, and they're upper, I like to say mid, but they're upper 40s. But so I'm fighting it just like everyone else. I love a nice ablative laser, but of course you can't do that all year round. So I do that typically, February to October. I live in Charleston. So there's plenty of sun, and I don't want to do chemical peels or lasers or anything ablative during the summer. Not that I wouldn't wear sunscreen. It's just there's so much incidental exposure. If you have a nice week, not like right now where we're hunkered down and on like curfews because of some storm. That is probably true, but I haven't seen it that bad yet. But anyway, what was I saying? So, when you get out, there's going to be sun exposure. So I try not to beat myself up real bad in the summertime. I use those kind of procedures would be things like Ultherapy. Ultherapy is something that's awesome. That's your high frequency ultrasound. You can do that year round. You're not going to ablate the skin. You're not going to microneedle. You're not going to have anything that damages the outer layer so that you're kind of putting your face at risk when you're around sun. And I guess I should go back to tretinoin also. Tretinoin will make you more sensitive to sunlight. So it's important that if you have patients on tretinoin, you're either cycling them off or you let them know how important it is that they don't combine that with other ablative therapies, but they also always combine it with sunscreen. So that's a good one. I think I said ablative lasers. I love anything ablative like your CO2s, your erbiums. Those are definitely going to cause skin turnover. But also anything with radio frequency. So when we talk about radio frequency, I think most people are going to think about the microneedles, but we also have radio frequency things like FaceTite and things that surgeons do, like they'll put cannula in with like that J plasma or something like that. Stuff like that can stimulate collagen. Anything creating a wound. I love the radio frequency microneedles. Those are very nice, but also I have a microneedle that has a needle end, but it also just has a radio frequency end. So it's actually a spot that will send the radio frequency heat down to the skin, but it's not going to actually penetrate the skin. So that's nice for people that you do want to kind of tighten, but they're not going to be able to take the downtime of a microneedle. And then a lot of these devices too, I don't know if you're a Cartessa person, the Virtue Cool Peel, Cartessa or somebody, kind of coined it, Virtue, and then Cool Peel, which is basically the radio frequency microneedle. Do a couple passes of that, the Virtue Secret, Morpheus, whichever, followed by a laser, which is the Cool Peel. Their lasers, the Cool Peel, the Tetra, which is basically a CO2 laser. Cool Peel just means it's a CO2 laser at a little bit lower setting. So you can combine those and stack them. Another thing you can do, if you've got them in the office and they're one of those people that are like, add to cart, do it all today, check me out, I'm ready, then throw in their injectables too. Now, injectables is probably where I get super excited. When I first started, PRP was big. It was it was the biggest biostimulatory. I also worked at a med spa that did the ALMI procedure. I don't know if you guys have heard of that one. That was, it was using fat. It was fat transfer. I think it was like autologous liposomal mesenchymal cell transfer. That's what, oh, no, what's the I? Anyway, something like that. But the ALMI procedure, we basically would take a cannula with manual vacuum pressure. So I'm talking like a 60 gauge syringe, pulled out with the cannula, trying to suck fat out of these people, and we just used local. This was not a surgical procedure. We'd suck that fat out, and we use that adipose tissue to kind of break it down, break the cell wall, get the fat out, and re-inject it. And you could re-inject that anywhere. Kind of like we're injecting Radiesse, Sculptra, or whatever, Belafil into the face. We would do that with their fat. Now that's extremely expensive, and it's higher risk because there's a lot more injections going in the patient. But also they're using their own fat and their own stem cells. So just like PRP, we're using our own platelets. Stem cells are going to be one level above PRP. It's going to have more of the growth factors, but PRP is going to be your peripheral blood. We draw your blood, centrifuge it, and take out the platelets. The platelets have those growth factors, and the growth factors that we really see mostly in these platelets that are going to be great. There's usually, I think it's 8. But the ones that we care about are the ones that help stimulate cell growth. Now, there's other growth factors in there that stimulate like blood vessels, et cetera. That's why we get such good results from PRP for the hair and for like the sexual rejuvenation. But when I'm talking about the face and the skin, we're talking about epidermal growth factor, fibroblast growth factor, FGF, EGF, IGF, et cetera. And so those specifically are going to be great to actually inject into the skin, or some people do it with like the gel, the easy gel or whatever, to do like under eyes. Now the gel does have more holding factor, and so people are considering that more filler-like than PRP-like, but it's all, at the end of the day, it's the same thing. We're getting the platelets out of the peripheral blood and injecting it into the face to kind of help rejuvenate and to build that collagen and elastin. So after PRP, then we start talking about the retail products that we can buy. Now this, I think the market really started with Sculptra and Radiesse. They've been around the longest, and then also Belafil. All three are different. These are your injectable biostimulatories. They're different, and they're different chemicals, they're different compounds, and they stimulate different things, and they're injected differently. Does that mean one is better than the other? No. It means know what all of them are, offer what you decide is best, but at least know the difference. So if you're not going to be able to offer all three, if somebody comes in and says, I want this, they may use a term like, I had somebody say, I want a Sculptra butt lift. And I'm like, okay, what's a Sculptra butt lift and what's your goal? And is Sculptra the best choice? Because I could actually do the butt lift with Belafil and Radiesse also with a little more volume. You know what I mean? So know your products. And those injectables right now that we have legally on the market are going to be Radiesse, Sculptra, and Belafil. Radiesse is calcium hydroxyapatite suspended in a gel carrier. Sculptra is polyl-lactic acid. It's not suspended, but you reconstitute it with some bacteriostatic water and lidocaine. The polyl-lactic acid is like those little threads. So when I talked about like the threads and the PDO glow, those are PDO, which is suture material. PLLA is like a little, it's a strand, like a tiny thread, but it also stimulates collagen. It's going to stimulate collagen type 1. It's not going to do 1 and 3 like Radiesse or Belafil, but it's also going to stimulate collagen. The one thing about those little threads is injection is very specific. We don't want it under mobile tissue because that's what can ball up in kind of granuloma. If you've heard about that, granulomas or nodules. I will say that a lot of the bad rap about granulomas and nodules is because when we first started injecting it, we were injecting it everywhere. And now we know about these rules like the mobile tissue, stay around from perioral and periorbital, stuff like that. So if you look at newer data, now that we've got a lot more experience, they're a lot more safe too. And the truth is, hyaluronic acid, which is our main injectable, the sales and shares of HA products are dropping. We've actually seen a decrease last year in sales of HAs while we're seeing a very strong increase in sales of biostimulators. That means that several things are happening. We as providers are becoming more educated and we're becoming better and we're offering better services and we're able to explain it to our clients. but also it means our clients are wanting better. They're wanting the best. They want to know what's going on. If you look at, if you follow TikTok or Instagram, everybody's talking about K-pop and K-beauty. They're like, I don't care what's next. I just want what's best. What's coming out next, And that's where we go back to, should I retail? There's some people that want all of it. Raise your hand. I want all of it. I want to know all of it. Not because I sell it, but because I truly love it. I don't know why it's embarrassing. People say, what are your hobbies? And I'm like, putting stuff on my face or putting stuff in my face or injecting stuff. Like, I love that. I'm glad that you guys cook and garden, but I like injectables. I like skincare. My hobbies are reading the latest scientific journals at night because I think this stuff is fun, we just started using Bellafill, we being myself and the Be Her group, but we just started using it earlier in the spring this year. And I absolutely love it. I love that we now have more choices. The differences in how they're applied. There's also differences in post-care for the patients. When we do sculpture, we have to make sure that they massage it for 5 minutes, 5 times a day for 5 days. So that's kind of a lot of work, but also it's a lot of, if there was a follow-up question or an adverse event, God forbid, whose fault is it? Did they not massage it right? Did you explain how to massage it? Did they pay attention? Did they over massage it? I actually had somebody come in with I think it was an occlusion from a lip filler that was done 2 weeks prior, but she over massaged it and she actually caused a little occlusion, because she had massaged it so much, it made a weird bruise in a weird spot and way later. And so I was like, well, try, compresses and aspirin, and it fixed it. So it was an interesting case, but I guess what I'm trying to say is, when we give people post-care and tell them a lot of things they need to do at home, I don't know how compliant they are. And I also don't know if they did it right. I don't know if they remembered, because they just got their face beat up and they just got this bill for several $1,000s. Did they remember that I said massage it 5 times a day for 5 minutes for 5 days? One of the things I love about Radiesse and Bellafill, we don't have that kind of instruction. I actually tell people, don't touch it, because I put it where I want it, and I want it to do what it's supposed to do. The more you touch it, the less I know about what happened when I wasn't there, for example. So some other things that spas might carry that do have like really good biostimulatory effects would be threads. Threads are the PDO sutures that we kind of put under the skin. The threads are coming a long way too. I started my thread training like 5 years ago or whenever. I did thread training, and it was just PDO sutures. They're kind of in there, and there's some barbed and then there's some smooth. Well, now they're kind of coiling them. They're making smooth ones that give more volume. They're making threads that actually have 3 times as much product in it per needle. So we're getting really good advances with using some threads. They do have a little bit of hand holding. Some people are more educated about it than others. I think it's extremely important that we stay educated, whether or not we decide to offer it. It's still good to know, right? And I'll tell you, I love threads. I love some threads, but I don't love all threads. I love some skincare. I love some growth factors, but I don't love them all. The truth is, try it. And whatever you like is what you're going to be better at selling. So if it's something you truly believe in and something you truly like, you're probably going to do really well with it. Also PRP, I think I said that a little bit. I still offer PRP. I love it. It's not for everybody. It's a different procedure. It takes a little longer, doesn't quite last as long, but it has its place. Like for the sexual rejuvenation, I don't think there's anything better than PRP. With the price point and the results that it gives, I absolutely love it. Now, if a man was looking for an enhanced result for their sexual rejuvenation, like size or something, PRP may not be the best. Then we might start talking about using a biostimulatory filler for the penile size for, that kind of treatment. It's not often, it's not the biggest, most requested service, but it's possible. And it's something to talk about because it does exist. So that kind of ends on my favorites, like the Radiesse, the Sculpture, the injectables, the Bellafill. The other thing I love about this is that for all those areas, as injectors, we started with injectables and med spas. We were really talking about the face. We were doing, wrinkles on the face. We were doing fillers for the face. We're doing biostimulation for the face, but we were ignoring the important things like the neck and the hands, the things that kind of tell your true age. If you're not microneedling and injecting your hands and your neck, your face your skin isn't all going to match, So I tell people a lot of times they come in and they say, well, I think I'm starting to worry about these little lines around my mouth. They may be a client that I've had for 3 years or something, but those lines around their mouth are a little bit newer and they see it because everything else looks smooth, you know? And so it's like, yeah, let's keep smoothing, you know? I'm glad that we're not worried about our eyes like we used to be, but now we're noticing the mouth. Let's just keep going. Then they're going to notice their face, their body, their hands. That's where I love using things like hyperdiluted Radiesse and hyperdiluted Bellafill. Those are just amazing. And when used when used subsequently, a couple treatments, those results last years, you know, years. And so, you know, I think it's important not to do just one or the other, but do all of it. I hyperdilute my body head to toe. I do. Even though I do fillers, even though I do toxin, the rest of the skin, I still want diluted with something. I think of it as like the skincare that I may have forgotten to do. So if I've got Radiesse and Bellafill injected intradermally in my skin, and it's building collagen, it has those particles and they're stimulating collagen and elastin for years, that's just like a security blanket, but also it makes me look good, you know? So, you know, what is the best biostimulator? I have no idea. You know, if we were to ask a poll, it would be hard to choose. It would be hard to choose a favorite. People used to ask me all the time, if you're stuck on nobody ever asked me this, but I used to always say, if I was stuck on a desert island, what would I take with me? And it was like Radiesse. You know, it's a biostimulator. I don't know that I could live without my toxin, but maybe on the desert island, I would have them like face tune out wrinkles because the skin would look so good. I don't know. But anyway, biostimulators, if you don't know about them, it's definitely time to get on board because they're growing. HAs are going down. So it's good to know about them. And one thing I love about MedShift and the MedShift store is that we can kind of give you a lot more options there too. And then I just got asked if we ever use Bellafill and Radiesse together. 100%. I use all of it together and sometimes HAs together too. Radiesse and Bellafill are also, they're both great, but they're both a little bit different. Radiesse we can really put on bony areas to inject and give that nice big fat lift. Some people may not be a candidate for Radiesse or Bellafill, so then the other one would be a good choice. Bellafill is a bovine collagen, so we do have a skin test. If people, you know, are nervous about being sensitive, they can do that skin test prior, whereas we don't have a test like that for Radiesse. I love them both. I'll tell you, I love them both. And if you're really going for longevity in like an area of the body, you know, like the people were treating these crepey arms or the front of their knees, my pickleball ladies, I love them because they like their tennis skirts, but they don't like that little wrinkly knee skin, right? So we hyperdilute that. They're happy as heck. But that might be something that you either combine both, you know, like do a treatment of Radiesse and then follow it with a Bellafill. To me, more is more, right? The more that you can do, the better. They're all great. Doesn't mean one is always better than the other. No, it really means you need to know your options. You need to know your patient. You need to know what they're asking for, and you need to know what their budget is. And then you can kind of develop like an entire plan for all of that stuff together. So I was able to cover kind of all my favorite things on the biostimulatory market. I think I kind of hit on most of it, most of the stuff that's going to come in your door and the questions that you're going to be asked. But if there's other stuff that I forgot, feel free to either reach out and talk to me, ask me later. I will put inside of this chat box right now, I'll put my information so that you can reach out to me. But you can also always get a hold of me through MedShift, through our everybody there that sets this up. So you probably all know Allie and a lot of the girls that help a lot. And there's everybody has a sales team through MedShift. But I am not really on the sales team at all, but I'm definitely on the education team. So if there's questions about education, what should I get, how much, you know, blah, 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 I'm happy to help with that. If it's about the actual orders and stuff, I'm not as good at that. But if anybody has any more questions, this is a great time. I did put my contact info in the chat. If you have questions, feel free to ask. And meanwhile, if you do have feedback for these webinar series, or if you'd like to be on one with me so we could make it a discussion, I would love that. I would love to have people kind of do a roundtable with me every month too, as we grow. I think it'd be fun and be pretty conversational. So anyhow, that is what I have for now. If nobody else has a question or anything, we can go ahead and log off until next time. Anyone? Doesn't look like it. Okay, well then I'm going to go ahead and end our chat. It's been fun. Thank you all. I appreciate you, and I'll see you next time.